Chapter 6, Video 2. Now we're going to talk about monitoring a patient's blood oxygen level. Pulse oximetry, that is one term that you need to know. This is whenever you place a probe on the patient's finger. You can put it on their finger, toe, earlobe, nose, or forehead. The toe or foot in babies, but it has a light on it, and you place it on the skin, and it senses what your blood oxygen level is, okay? ABGs are commonly known as arterial blood gases. This actually requires a sample of arterial blood. This is usually collected from the radial artery in the wrist, and it's drawn by a trained respiratory therapist, nurse, or doctor. We do arterial blood gases, which you will commonly hear referred to as ABGs. We do this on patients who have COPD or respiratory distress. This is the most accurate way to measure blood oxygen. So pulse oximetry is the least invasive. We're not breaking the skin. We're not actually going into the body. There's a probe placed on the skin that tells us our blood oxygen levels. But the most accurate is ABGs, the arterial blood gases, and that's that blood being collected directly from that artery and telling us what those blood levels are. What disorder affects the ability to carry oxygen to the body? Your choices are anemia, paralysis, cancer, or pulmonary embolism. The answer here is anemia. The body's ability to transport oxygen can be affected by a low red blood cell count. So this is affecting the ability to carry oxygen. Don't confuse this with the pulmonary embolism. Remember, with the pulmonary embolism, there's a clot blocking the flow, so the blood's not getting the oxygen that it needs. It's not affecting the ability. The blood's just not getting there to the alveoli. When we were talking about pulse oximetry, here is a picture you can see. Here's a picture that you can see. This is actually the probe being placed over the finger, and they even have ones that have tape, so when they're monitoring babies and stuff, they won't be pulled off. And you may see the tape ones used on adults as well. Which is a normal pulse oximetry reading? The answer here is 95% to 100. The amount of light that reaches the sensor is translated into a measurement of how much oxygen the arterial blood is actually carrying. Now we're going to talk about arterial blood gases. Again, this is more accurate than the pulse ox. It's much more invasive, and it actually requires a sample of arterial blood to be drawn from the wrist. Now we're going to talk about the different devices that are used to deliver supplemental oxygen. So if we see that a patient has a low oxygen level, then we can give them oxygen. And there's different devices here that we use for this. So we're going to talk about those. So first we're going to talk about the nasal cannula. The nasal cannula, this is the nasal cannula. It sticks up in the nose, and I'll go through the pictures and show these to you, but I would like for you to go through the book and look at the different types of devices used to deliver supplemental oxygen. We have the nasal cannula, the simple face mask, the non-rebreather mask. We have the continuous positive airway pressures, the mechanical ventilators. What I want you to focus on when you're looking at these different devices that are used to deliver the supplemental oxygen, I want you to make sure that you know your flow rates, okay? That's very important because you will see those on the test. You want to make sure that you know the flow rates that are used with the different devices, and we need to make sure that we know what is actually prescribed to the patient whenever we are using these different devices. So we need to know what's prescribed, and you need to know which flow rates go with each of these different devices. And this is a face mask. I'm going to flip through and show you this. Also, we have different equipment that's used with patients who experience sleep apnea. Sleep apnea is when they stop breathing during their sleep, and they may use a CPAP for this with these guys. So a person with a sleep apnea may also use a CPAP. The answer to that is true. That CPAP, it actually pushes air in and it keeps that airway open, and it prevents that person from stopping breathing. When we care for a patient with using supplemental oxygen, we need to make sure that we provide good mouth care, oral care, because this oxygen can be very, very drying, and it can irritate the mucous membrane. So just making sure that we provide good oral care, and we need to always check the water bottles for humidity. Make sure their water bottles are not emptied, because the water can actually provide humidity, and it moistens that air so it's not so drying. And then again, we need to check for pressure sores on the face and behind the ears. And we also need to look for nosebleeds. Maintaining an open airway is super important. Patients with respiratory disorders may experience some mucus plugs. They may, become real dry. There's various reasons that a person may have problems breathing. So we just need to make sure that we're watching their airway closely. Suction may be done on someone with chronic bronchitis. If the patient can't cough and they can't clear their secretions, we may send a tube down and suck those secretions out. There's different airways here. We have the oropharyngeal airway and the nasopharyngeal airway. We have endotracheal intubation, a tracheostomy, and there's a way that we suction a tracheostomy. I'm going to go over the skills of this in lab with you guys when we come in on Tuesday. But in the meantime, I want you to go through the book and know your steps. Go through everything in the chapter and know your steps and be familiar with this before we get into lab. We may suction a person if they can't stop coughing, if they're having trouble breathing, if they ask to be suctioned. We may have to suction if they have a pulse ox less than 90 or their heart rate is increased, because that could mean that they're not getting any oxygen. This is a nasopharyngeal or an oropharyngeal airway. The nasopharyngeal looks like this. It goes down, it passes through the nose. So you'll see it kind of passes through the nose and it gets that open where air can pass through in and out. And the same with the oropharyngeal, it goes through the mouth and it opens that airway in that manner. This is an endotracheal tube. With the endotracheal tube, it's important to perform frequent oral care. We need to monitor the patient. We need to reposition. We need to watch safety, comfort. It's a flexible plastic tube that is inserted through the mouth or the nostril, and it has a balloon cuff on the end. Right here, you'll see that balloon cuff holds it in place, and it prevents secretions from draining down from the mouth and actually going into the lungs. So with the endotracheal tube, it passes down, this cuff is inflated, and that stops the secretions from going down below, and it's also providing for an airway into the lungs. Now we're going to talk about the tracheostomy. With the tracheostomy, I'm going to flip to this slide and show you the picture. That's when a hole is actually put into the throat, directly into the airway. With the tracheostomy, it's very important that we maintain good care with this, because this goes directly to the lungs. We can't get water down in this. We often see this with patients who have been paralyzed for long periods, and you guys will learn how to clean the tracheostomy, and we're going to go over that in lab. But in the meantime, I want you to know your steps and be able to answer questions for it on the test. But this tie strap ties, the ties secure the tracheostomy to prevent it from dislodging, which I'm going to show you that in lab. And you can see these tie straps here. It's placed into place, and then we tie it on one side, take it around the neck, and tie it on the other, and that actually holds it in place. So When we're performing this tracheostomy care, we're going to clean this with a gauze sponge. Then we're going to use sterile saline, and we're going to clean outward in that circular motion away from the tracheostomy tube. So again, please review your steps. We will be going over those in lab. That is it for Chapter 6, Video 2. If you have any further questions, please let me know.